Hi, welcome to the class on diabetes basics. Today we will just see what type 2 diabetes is all about and how does it affect your digestive system. So let's look at the first slide. Um, the first slide talks about the five elements which are critical in managing diabetes. The first is the medicine, the medication that your doctor gives you. The second is the meal planning. The third is activity, that is physical activity. The fourth is monitoring. And the fifth is education about what diabetes is all about and how you can manage it well. So let's look at what are the numbers, like the blood sugar levels, what makes a person diabetic. So here you see that there are three numbers. The first is normal. Normal is when the blood sugar glucose levels are 100 or below 100. A person is said to be in the normal range. A person is said to be pre-diabetic if his blood glucose level is between 100 and 125, and is said to be a diabetic if his blood glucose level is above 126. These are numbers which have been taken before any major meal, that is your breakfast, lunch, or dinner. Now, to get the proper diagnosis, a person is checked twice. One is before meals, and one is 2 hours after a major meal. So, 2 hours after a major meal for a normal person, the blood glucose level should not be more than 140. And for a pre-diabetic, the blood glucose level is usually between 140 and 199. And for a diabetic, it's usually 200 or above. Now, these numbers are just indicative. It's basically your doctor and you decide whether you come into which category you come into, depending on various other factors that also influence a person to be diabetic. So, the other factors that influence a person's uh, that make a person at high risk for diabetes are being overweight, being above 30 years of age, a family history, or somebody or a woman who's had gestational diabetes, or if someone has given birth to a child who is 9 pounds or more. And then there are some races which are genetically inclined to be diabetic, like the African Americans, the Hispanic, the Native Americans, Pacific Islanders, and Asians. All these races are genetically inclined to diabetes. So, if you have a question, you could type it out. Yes, what can a pre-diabetic person do to prevent going into full-blown diabetes? Very good question. Yes, what a pre-diabetic person can do is have make major lifestyle changes. Diabetes is basically condition epidemic has been termed as an epidemic related to lifestyle. So making major lifestyle changes can be very helpful. So what happens when you are diagnosed as a pre-diabetic? Your doctor will work with you and put you through with the dietitian who will help you have a better meal plan, a better food management, a better way to manage your exercise so that you do not become diabetic, because small changes in diet and your daily exercise itself can have a huge impact on your diabetes. So now, what exactly is diabetes? What is happening in your body when you have when you have diabetes? When you have diabetes, your pancreas stop producing enough insulin. When it is type 2 diabetes, pancreas do not produce enough insulin. When it is type 1 diabetes, pancreas do not produce any insulin at all. So now when the food enters the stomach, it converts into glucose. And this glucose has to go and attach itself to the red blood cells to produce energy. And how they attach to red blood cells is with the help of insulin. So when the body does not have enough insulin, the glucose does not get attached to the blood cells and instead starts flowing through the blood vessels in form of sugar, and that's when you have high blood glucose levels. So when the medications that your doctor gives you affects helps the pancreas have a better have a better help pancreas release more insulin or the required amount of insulin for your body. So here you see that the pancreas are a very integral part of the entire diabetes condition, and you need to know that the pancreas they start to do this very slowly. They release insulin, they produce insulin which is required for your body, and once they start producing less and less insulin, you can go towards taking direct insulin shots. But as long as they're producing some amount of insulin, you are still you still on tablets like metformin. Let's look at the next slide. Yes, the facts of type 2 diabetes. There are two kinds of diabetes. One is type 1 and one is type 2. Type 1 is usually a condition where the pancreas have completely shut down. They do not produce any insulin. Type 2 diabetes is when the pancreas still are producing some insulin but not enough for your body. The facts about type 2 diabetes are that it will occur in 90% of all people who are at high risk, and it's usually diagnosed in adults over 30 years of age, but nowadays it is also seen in children like teenagers. This is when the body cannot produce insulin properly. The glucose builds up in the blood because the body is resistant to insulin it produces, or the body does not make enough insulin. The symptoms, these usually come gradually. The symptoms could be anything from starting from feeling tired. You tend to feel tired very easily. You have dry, itchy skin. You have numbness and tingling in your hands. You could have frequent infections. Another indication is if you have any sores or cuts, they take a much longer time to heal. You could have blurred vision, and there's problem with sexual function, and there's increased hunger, thirst, and another major indication is frequent urination. So if you have any of these symptoms or all of these symptoms, it's a good idea to consult with your physician, because these symptoms might be common, but they do tell a lot about what is going on with your body. So how do we manage diabetes? Diabetes basically you manage by regularly checking your blood glucose levels, taking prescribed medications properly, following a healthy meal plan, and exercising regularly. If you are overweight, to maintain a healthy weight is a very good idea to it's very helpful for managing your diabetes, and following a treatment plan according to what has been given to you, um, to the T, as much as you can. You have a question. Is insulin available only as a shot? Yes, insulin is available only as a shot, which it's not very painful. It's a very tiny needle, and it's available only as a shot. Yes. Why is losing weight helpful for diabetes? Losing weight is basically when you are eating better, you lose weight. So it's not the losing weight part of it, but when you are eating better, you are obviously going to lose weight because you have changed, like moving from white wheat to whole grains, moving from refined sugars to whole foods, moving from more junk food to eating more healthy and fresh food. So that's and the result of eating better is weight loss. So that's how you lose weight. So I hope this was helpful for you, and you could also log into the American Diabetes Association website at www.diabetes.org for a lot more information. And I hope you will come back for the next class soon. Thank you so much. If you have any questions, uh, please put it in the window, in the chat window, or we can finish now. Do you still have any questions? Okay. Thank you so much. Bye bye.